Hi, so we are talking about GBS, and I'm here trying to put forth how Prakriti evaluation goes hand in hand. Say, if I was to say that, let us assume we have a 40-year-old patient, and as we see as of today, that there are a lot of cases in Pune coming up. So, let this patient be from Pune. In his history, he happens to have a gastrointestinal infection, and in the aftermath of it, it is seen that he develops GBS. Now, on Prakriti evaluation, we can analyze as to what is there, what changes are there likely in the future course of life, and how IUSCAN presents those details is what I'm trying to put forth here. Basis of IOScan, we get into deep-seated analysis of Prakriti, and we analyze it along with Prakriti in sync with modern laws of thermodynamics and quantum theories. Uh, this has to be seen in a way that when this individual comes across, what IRSCAN puts forth is not just the prakriti of the individual, but how each of the bodily systems reflect as to their individual prakritis. And when we look at the thermodynamic and metabolic impacts, we can see that there are two conditions to be seen. One is a mild GBS, where primarily, as per Ayurvedic concepts, Agni or Pitta is raised, making it a hypermetabolic state, which leads to an erratic function of Vata and leads to an impact on 60% of efficiency. Entropy here is increased by 15% to say. And these are figures derived from a Prakriti data set that is drawn basis of the age of the individual being 40. Now, there is a graphical representation that I present, and it would reflect that primary areas that get affected are Majjava Srotas, Manova Srotas, Annava Srotas, and Raktava Srotas in case of a mild GBS infection, which reflect as the Vat being raised by say 30 points from 0, Pith being reduced to 70 from 100, and Kaph remaining at 0 for the Majjava Srotas. For Manova Srotas, the Vat increases slightly from 16.67 to 20, and Pith rises to 55 from 50, and Kaph falls to 25 from 33.33. In case of Annava Srotas, there is again an increase in Vat by 5 points to 25, of Pith by 5 points to 45, and a fall in Kaph to 30 by 10 points. For Raktva Srotas, the rise in Vat is again 5 points from 0. The Pith rises very marginally by 3.33% or 3.33 points to 70, and Kaph falls to 25 from 33.33. What is seen as a reflection is that in case of Majjava Srotas, nerve instability is there and inflammatory focus shifts. The Manova Srotas displays anxiety, mental heat, and mental grounding. Annava Srotas reflects irregular digestion, lingering infection, and mucosal weakening. Raktava Srotas will reflect circulatory stress, immune activity, and the decreased viscosity. Now, this is how a translation in case of mild GBS may be seen when the precursor was a gastrointestinal infection. In case of a severe GBS, the catabolic overload is very, very high, and structural collapse happens with a much depleted cuff, leading to a 30% efficiency, in falling from 100 to 60 in the case of mild and to 30% efficiency, further low in case of severe GBS. Entropy rises very high in a chaotic manner to reflect 50%. Mild GBS will show an instability which is dominated by Vat and Agni, whereas severe GBS will show a very high Vat and a very high Agni impact. In case of severe GBS, the srotas that are impacted are Pranavaha, Udakvaha, Mansvaha and Swedvaha, which translates as Vat in the case of Pranavaha srotas rising to 25 from 14.29, Pitta rising to 60 from 42.86, and Kapha falling drastically to 15 from 42.86. Udakvaha again rises mildly to 60 from 50. Pitta again falls to 40 from 50. Kapha is unchanged. Mansvaha shows a sharp increase to 35 from 21.74. Pitta shows a sharp decline from 56.52 to 35, and Kapha becomes 0 from 21.74. Swedvaha shows a slight increase in Vat to 10. Pitta shows a slight fall to 90. Kapha remains unchanged at 0. Given this situation, we see respiratory chaos, lung inflammation, structural collapse, fluid imbalance, compromised inflammatory regulations, muscle wasting, inflammatory breakdown, tissue loss, sweat dysregulation, inflammatory sweating persists. Now, these changes reflect that the Majjavara srotas in case of mild GBS shows a 20% increase, and in case of severe it shows 60% increase, which means that if the ideal lifespan was 121 years and the individual until the age of 40 did not have any distortions to Prakriti and it was on track, then the cumulative nerve damage for him was of about 10 years of a decline. That is, his neural age would fall to 111 years. Pranavaha srotas shows an impact of 10% in GBS, which is mild, and 80% in case of severe, which means a lung dysfunction of 15 years. So in that case, the expected lifespan falls to 106 years. Anavaha srotas shows a 15% in case of mild and 30% in case of severe GBS, and digestive frailty shows a 5 years decline. Now, srotas wise impact, thus a futuristic impact, will be something like in case of mild GBS as discussed and severe GBS, but it will all show that such an occurrence is leading to a decline in the age of the individual. And these important systems that get impacted Prakriti wise and their individual ages decline, on an average, there would be a cumulative additive disadvantage that would come across. This is calculated mathematically, wherein the impact is calculated basis of entropy. Now, the formula for this is discussed in this presentation, and we see that Majjavara srotas would therefore show a decline of about 2 years, Pranavaha about 1.5 years, and Anavaha about 0.75 years, totaling to an impact of somewhere around 4.25 years in case of mild GBS, the rest being compensated by other factors of age, bringing it to 116.75 years instead of 121 years. For severe GBS with ARDS as a sign, the same would fall to 101.5 years, which is a fall by 16.1%. So, this decline is related to thermodynamic instability caused by an increased entropy in both the cases. The higher the entropy, the widening the probability distribution, and that leads to an increasing chance of early mortality. This would mean that longevity risk is at a critical threshold where the total entropy should not and cannot go beyond 100%, which is like 1.5 years for every 10% rise in entropy. And the cumulative impact is something like persistent entropy change in case of Majjava and Pranava Srotas post recovery reduces the lifespan by 5 to 7 years of a decade. The assumptions in all this are that entropy values are additive across Srotas, lifespan impacts are independent and not synergistic risks, baseline lifespan assumes optimal health, no prior entropy. These assumptions make it clear that basis of Prakritic analysis, what one can do in case of such infections is not just that you can draw or derive a calculation that will say what are the translations in different systems at that particular time, but also their long-term impacts in future. Since GBS is curable to a large extent, except when it is very severe and their residual signs will be there, the impact on age as on date can also be further reduced. However, Prakriti analysis by itself is a very strong reflection on how Ayurvedic diagnostics works, not just on the treatment of the disease, but also in enhancing the metabolic patterns and in enhancing the uh, longevity of the person by regulating Prakriti, the functions of different systems at a very, very small level, at a very, very fractional level, where small changes can reflect into changes of a large, large scale when it comes to management of diseases, both in short and long term. So it's not just therapeutic, diagnostic, but even prophylactic therapy that matters. Thank you.